to order. Conduct a roll call.
Which side do you want to start with? Mike Suford, present.
Mary Mack, present.
Charles Davis present.
Ralph Taylor present.
And Brian Keeley present. All present. We have a quorum. Do we need to open up the meeting with a vote of any type?
Nope, there's no public hearing today.
Okay.
We just have to approve
Just the
minutes.
approval of the minutes from February.
All right. And we're going to move on to the second item on the agenda. Do I have a motion to approve or disapprove the minutes of the February meeting?
I motion that we approve the 12/20 meetings, the minutes.
I'll second.
I have an emotion. I have all kinds of emotions.
Same.
I have a motion and a second to approve the meeting minutes for the 12 February, right after the Super Bowl meeting. All in favor say aye by your name and your vote.
Mike Suford, aye.
Mary Mack, aye.
Charles Davis, aye.
Ralph Taylor, aye.
Brian Keeley, aye. Motion carries. We approve the meetings of the February 12th meeting. Moving on to motion, or item number 3. Go ahead there, young lady.
Sure, I, first of all, just want to let you know that our February meeting, I did give you an updated status of reports and also financial expenditures and how that were going with the agencies. And so I thought it was fair, since there were updates, to make sure that you had those updates given to you. All agencies who are currently receiving CDBG funds are trending very well. So you will see in one of the extra sheets that you have there, in red ink, it says as of 3/11/24, it tells all of our current CDBG public service agencies that are receiving funds and how much they've expended so far, which is obviously just an update from last month. If you remember right, there were a couple of agencies that had not had any reimbursement requests in, and I had some notations onto the side, and since then, as I indicated, they have spent funds and funds are trending well. There's no concern to think that anybody who's currently getting CDBG funds will not be able to expend and move forward. So wanted to give you that update before you move forward in case that was a question anybody had for one of the agencies. You could eliminate that. That all is well. And then afterwards, after the agencies are done, they were asked to give about 2 no more than 3 minutes of any information they wanted to give you, and then giving you that opportunity to be able to ask any questions if you would have them before you do any of your voting. So after the agencies are done, I did put together the aggregate information from the scoring of your applications and also some other information that options for discussion purposes only to fund, because this is your decision and nobody else's. The board should be deciding this. So having said that, I think we're ready to move on, if that's okay with you, to start off with the first agency according to the list on the agenda.
Absolutely.
Okay, so up first is Ms. Shelby Bowen from CASA.
To let you know.
I am Shelby Bowen. I am the finance coordinator with First Judicial District CASA Association. I want to let each and every one of you know public speaking is not my thing and I am nervous, so please forgive me. CASA is located directly across the street, and we're at the corner of 5th and Shawnee, so opposite of the city building. We are requesting this grant for rental reimbursement. We are the only entity within the city of Leavenworth that serves Leavenworth citizens, ensuring abused and neglected children have their voices heard in the court system. The citizens of Leavenworth need this organization and the programs we house not only to advocate for abused and neglected children, but also to educate families about how they can prevent abuse from happening in their families. Thank you for allowing me to speak. Do you have any questions for me?
I'd just like to, set up a meeting where I can just do a walkthrough with
Perfect.
CASA. No other questions, no.
Okay,
I'm gonna send you, Vice Chairman, Ralph Taylor's information.
would you send that directly to me?
I will send it directly.
Send mine as well.
Yeah, I'd like to do that.
I'd like to go on that same,
Would you like to see all of them?
we would, I would actually, it's been something I've been thinking about doing.
Why don't I
so-
do this? How about I just email all of you, all of the contact information of the individuals that run these agencies here in town? Would everybody like that?
Perfect.
Everybody good?
I just need CASAs. I've seen everyone else.
I know you have. You've been all last
I'm
year,
happy,
I'd love to take a look at everybody's.
yeah, you're
Okay.
fine, I'm just,
I'll do that.
Okay, thank you.
all right.
We have Catholic Charities is the next on the list.
Good afternoon, I'm Jackie Masner, and I'm the manager of Catholic Charities, which is just down the road here. First off, I want to thank you for your ongoing support. Our request this year is for $7,800. Catholic Charities, the agency, we do a whole lot of things at our agency. We are paying people's rent, we're paying their utilities, we do that with our direct financial assistance, our emergency solutions grant, and our balance of state COC funds. In addition to that, we also hand out clothing and household items, so when you go to do that walkthrough, let me know so I can get that stuff put away. You should have seen what come in today. We do Thanksgiving assistance for families. We also help people with their food stamp applications. Our food pantry is a client choice. Last year, every month, we averaged about 1,100 individuals that utilized our food pantries for the month. For our seniors, we do our commodity supplemental food program, and our seniors that are homebound, we do home deliveries for those folks. Okay. In addition to that, we have our Kansas Loan Pool, which is our payday title loan program. If somebody has one of those, we help them get out from underneath of that, okay, and work with them for the duration of that loan. We've got a family financial transformation class, which is teaching better financial budgeting skills, pardon me, okay. We've also got a position open for what we call workforce, someone to help somebody who is seeking employment. Currently that position is open, okay. Volunteers, I have close to 40 volunteers a month, okay. Last year I had like 5,800 hours of volunteer hours. So the Family Support Center, we have 3 full-time employees, and I have 3 part-time employees, and the rest is volunteers. Basically, we utilize the community and our employees, and we do everything we can to just give back to the community and support the community in any way that we can. Okay? Thank you for taking the time to listen to me, and do you have any questions?
Knowing that I'm gonna come visit, I'll save some of them for the visit, but do you have a screening process for visitor, or for your volunteers?
Yes, they have to go through our volunteer, Catholic Charities has a volunteer coordination, thank you. They have to be, we do a background check. They also have to go through the Virtus training,
Oh, okay.
okay? So, yeah, there's an extensive,
No, I know how extensive that can be. I've had to do it for, on post activities with the chapel, so I understand.
yes. And we do the same thing. Volunteer, normally they have to go through that entire process before they start. If the only thing that may be a little bit off is they will do the background check. If Virtus is coming up on the training here in a couple of weeks, they'll let them go ahead and start as long as they're monitored in the office.
It's good information. I appreciate that. Like I said, I've got a couple more questions, comments but I'll definitely save that for a visit for sure.
Okay,
Thank you.
looking forward to it.
What are the requirements for the position that you have open?
I'm not the one hiring for that. Do you know what the requirements are for that?
So it's a workforce position, sorry, it's a workforce position, so they would just need to have some type of experience helping individuals with case management. A lot of the training is actually done to provide that type of workforce, case management in-house. So they would just have to have, you know, they can apply on our website. I don't know specifically what the requirements are, but it's gonna be similar to any type of case management.
Okay, thank you.
The money you're requesting, that's for you, that's utilities, is that
That
right?
is for utilities for the building.
Okay.
I will tell you, I was very pleased with my visit, so
Thank you.
you're welcome. I didn't know what I was looking at, but I was very, no, I'm good. You explain how you.
I think you're ready, Ms. Miranda. With Leavenworth Interfaith Community of Hope.
Good evening, Board. I am Miranda Agnew with the Leavenworth Interfaith Community of Hope. Our request is for $15,000, all going towards utility assistance. We do own our building outright, and so that is a portion of our utilities each year. We have been a previous recipient. As you know, the Community of Hope, we are the day center night shelter in Leavenworth County, primarily serving Leavenworth citizens. We do have our day center and night shelter. We also have our resourcing center, which we call Welcome Central. And although we did step out of doing full-time transportation, public transportation, once the city began theirs, we do quite a bit other case management and that in Welcome Central. We also do the clothing handouts and supplies needed. Something new in the last year plus is really partnering with those professionals in our community who are doing much better work than we could ever do with our 3 full-time employees, trying to navigate a almost 24-hour business. So we have St. Vincent's that comes in our building twice a month and does on-site free clinic for our guests that we serve. We also have the Guidance Center on-site almost daily, so they come and do intakes, so that mental health process does not take a month to get somebody a mental health screening because of transportation or other roadblocks, so they're coming in our building weekly now and doing those intakes, as well as their housing and employment specialist being on site almost every week, as well as their ACT team. So what we have shifted from, just because of such limited resources and minimal staff, is just getting those professionals inside our building to serve the group that we serve. We did serve 241 unhoused individuals last year, everywhere from 4 months old to 83 years old. It gets a little bit challenging. We are seeing absolute record numbers in 2024. So when I stand in front of you next year, our numbers will be significantly, maybe doubled what we saw last year, because that's what we're seeing right now. We've never turned away anyone for being full. It just gets a little bit more complicated inside the shelter. So anyway, I would be open to questions if you have about our application or organization.
Not a question necessarily, but a comment. Just the humility, humbleness that you show, literally giving a shout out to those other entities that come to you and come into your area to do what they do, and to acknowledge them. That just shows, that just puts you right up there, and that's impressive to me. I think I can speak for the board.
I could literally do that with everyone in this room, which is super. It's a great place to be, and Julie and I have talked about this, since I came on, and, collaboration, and we're in organizations together, we grab coffee and learn what each other are doing and how, transportation was the perfect example. We were not doing transportation well, but we were doing it because there wasn't public transportation. And then once the city started, there was absolutely no need for us to do that, and so we pull out of that, and that's what we work with this group all the time. Our partnership with St. Vincent's has been just life-changing, and they're just down the road. They could have very easily said, no, we're just 3 blocks away. And they said yes, and they serve, I mean, they're there, like I said, twice a month serving anywhere from 10 to 20 people inside our building. But everyone in this room is that same way. We share resources with CASA. I feel like on a weekly basis, our cars are full and we're transporting, resources back and forth. So you have a great group of people working in nonprofits, in other words. Something to be very proud of.
We are in awe of all of your humbleness.
Yeah.
Can assure you.
I was just there Saturday, because I volunteer
Of
once a month.
course you were. I saw your name.
But when did they start serving sandwiches again? I know at one point they had stopped, but Saturday they,
Yeah, so we committed 3 years ago to being open extra hours in the winter. So historically, we close from 3 to 9, one just because of a lack of staff, but that's just how it was founded. That was how the organization was founded, was closing from 3 to 9. That was a struggle for me to be leaving at 3 o'clock, typically 5 o'clock, but 3 o'clock when the snow was blowing and it was negative 20 degrees outside. So 3 years ago, we committed that through the winter months, typically December through February, and expanding if we needed to, that we would be open 24 hours, 22 hours technically. We closed for 2 hours just to take a breath. So we stopped that at the end of February. The weather, knock on all the wood, looks better, and honestly 2024 we really need to figure out a way to sustain our organization, and so we went back to our normal hours at the end of February.
okay.
So yeah, we do serve 3 meals a day to the unhoused population. Anybody in the community can come get lunch, no questions asked. If everyone in this room showed up for lunch, we would serve anybody, but to the unhoused, we serve 3 meals a day. So we do serve a sandwich at dinner time or whatever we have on site. We served 20,000 meals last year without a commercial kitchen. So again, shout out to Meals on Wheels, because they are a lot of the reason we can do that. It's amazing how many meals they serve a day, only being able to warm up. And it's always a warm meal besides dinner, which is sandwiches.
Understand, and you still need volunteers, of course, right?
Always.
Okay, I got
Yeah.
1, 2, 3, 4, yeah. that'll
It
work.
takes 70, we're really, as we look to be sustainable, in an ideal world, eventually we would have a staff member all through the night. But currently we run on volunteers. As you know, I was there Sunday night till 2 in the morning. We run on volunteers all through the night, and it takes about 70 a week to run. So lots of volunteers are working, multiple times a month to keep us going. We are in our 6th year of operating like we currently do, so we're still barely walking.
Hey.
Going to kindergarten, that's what we're doing. We went to kindergarten this year.
That's awesome.
Mary,
That's awesome.
Mary, want to mention?
Yeah, and taking nothing away from the other agencies that are present, but I did want to just say congratulations to you, Miranda, because she just won the Chamber of Commerce Humanitarian of the Year,
Thank you.
and that says a lot for what you do for the community, so,
Excellent.
thank you.
Thanks.
And Leavenworth Mission.
Okay, greetings. I'm Iris Arnold, representing the Leavenworth Mission Food Pantry. In 2023, we relocated our food distribution site in hopes of downsizing in our smaller space of 3,000 square feet. But we soon discovered that our location on Broadway Street introduced us to a population that is most affected by the Northwest food desert area. We provide food commodities to the homeless, low-income families, and individuals. We are a partner agency of Second Harvest Community Food Bank. They provide us with the emergency foods from that program, but we rely heavily on donations and grants to help us purchase other foods for our clients that is not available through the TFAP program. A lot of the foods from the TFAP program are your nuts, a lot of canned goods. So we try to provide a variety of foods for our clients. So that's why we rely on the funding from other areas. And last year in 2023, we distributed 123,176 pounds of food, which equates to 102,646 meals using the standard Feeding America formula of 1.2 pounds equals a meal. We anticipate serving 450 families monthly for the 24-25 program year, which is an increase from previous years. We are requesting rental assistance to help relieve the burden of monthly payments so that funding can be made available to purchase sustainable foods for our clients. And we appreciate your consideration. Any questions?
What's your hours again, that I can volunteer? I'll come back volunteer. Seriously, no.
The food pantry is open every Tuesday except for the first Tuesday of the month from 11 to 1. But then we also provide an evening service, which is the last Tuesday of every month, 5 to 6:30.
Okay, thank you.
All right, and then the Alliance Against Family Violence, this is, and I apologize for not introducing each and every one of them. I think we all are so used to all of these faces. Katie Urban is the new executive director of the Alliance Against Family Violence, and so I just wanted to give that introduction for you.
Oh, thanks. So I'm not a big public speaker by any means, and I am new, as Julie said, I'm a committee member. So as far as agency history or anything like that, I don't have all of that knowledge to give to you guys. Something that I do want to talk about today is what we have going for the next fiscal year. So one thing, we are the only domestic violence and sexual assault agency for Leavenworth County, and we have done a lot of outreach to other counties as well, considering that there aren't agencies in Atchison or Donovan County as well. But specifically for Leavenworth County, we are increasing our prevention and outreach so that we are catching those individuals before they become unhoused because they are fleeing abuse. So we have flyers in doctor's offices, bars, at St. Mary's University, stuff like that. To also increase sustainability of people in houses, we have increased the documentations that we are able to provide for individuals as far as birth certificates, social security cards, etc., stuff like that, so that they can apply for housing. And once they get the housing through us, we provide tables, couches, toiletries, assistance like that, and to continue to make sure that they do not become unhoused again. We do checks 30, 60, and 90 days after they have left our agency to make sure that they are being successful out in the community in Leavenworth. Something I am very big about is getting the community involved. You heard from other people of how there is great community engagement between different agencies, and the Alliance historically has not had that between just agencies that are in this room, but also other agencies within the community that like to help individuals and nonprofits. Something that we are going to start doing is a monthly community engagement meeting that will be at First United Methodist Church the second Thursday of every month. This will be where anybody in the community can come and hear about what we're doing. Our location is confidential. For special people, we do tours, but for the most part in the community, we're not supposed to let everyone know so that we can keep our clients safe. But that has made it so that we have been very sheltered in the community and not out and about, and making sure that people know about our services and know about all the good that we are doing. So that is what I wanted to talk about. Thank you. Is there any questions?
You mentioned those, you said 30, 60, and 90 day follow-ups, assessments.
Mm-hmm.
How are those going? Is it something that you're seeing success, moderate success? I mean,
So I don't have stats off the top of my,
any
anything
stories
like
that you wanna, any success stories?
Again, 4 months in the job.
Right, no, I got you.
In the month of February, we did have 3 successes, so we are coming up on their 30-day right now. I think that we've done 2 of the visits so far. We call them if they are housed in Leavenworth County, we call them, and then we set up a time to come in and physically visit where they are, so then we can see how they are actually doing, but also it is up to the client on how they want to
Of course.
but we bring toilet paper, paper towels, cleaning supplies. We just automatically bring a whole bag of stuff to help them on their way every time. From what I've heard, they've been successful. We haven't had anybody that is not housed anymore from during their checkups or anything like that.
So you're real optimistic that the process is working?
I would definitely applaud you for stepping up to the plate, stepping in from your predecessor, so kudos to you. Thank you.
The funds is that for rental assistance or utilities?
They're for utilities. We have about $18,000 a year in utilities. We have about $8,000 that's covered under a different grant, so we're applying for $10,000. Okay, thank you.
And St. Vincent Clinic. Last but not least, Beth Watkins.
Hi everyone, I'm Beth Watkins. I am the manager of St. Vincent Clinic. We are the only safety net clinic for adults to receive primary care in Leavenworth County. Although soon we hope to be bringing on pediatrics. We've been working pretty hard getting equipment for that set up, so we're really excited to start opening our doors to the little ones soon. We, in addition to primary care, we also have in-house behavioral health, which just started this past year. We partner with St. Mary's for physical therapy and Cleveland State College for chiropractor services. We have a pharmacy assistance program where we give about $1 million in free meds to our patients last year. We have 3 full-time providers, and I can tell you our whole team at St. Vincent is really driven by our mission. We believe that each individual in the community is what contributes to a healthier community. And it's really important for those who do not have access to health care to have quality health services. So we primarily serve underinsured and uninsured people. We started taking Medicaid and Medicare over the past couple of years, and we've seen a significant growth in numbers of people that have insurance. We're also taking Ambetter, and we hope to increase the number of insurances that we take so that we can reach more people who do need health services. We partner with pretty much everyone in this room so that we can help identify who these people are that do not have access to quality health care and get them into our clinic. Over the next year, we are, in addition to pediatrics, we're just really excited to kind of build our numbers, and we're pushing this philosophy of the way that we say it is we want to teach people how to become an advocate in their own health care. So as a safety net clinic, we don't, even though we love our patients and we don't want to see them go, we also want to advocate for them in every which way and see them as a whole person so that they can get back on their feet and become more self-sustainable in terms of getting that insurance that they need, getting those jobs, becoming healthier. So many people are unable to work because of their health and whatnot. So whatever that we can do to identify those barriers for people and help them overcome them so that they can become healthier and work and get this insurance that they need, because that's what's going to make us a stronger community as a whole. We are asking for $13,000, and that's just for utilities. And if you have any questions, or if anyone wants to come for a visit, I love to give tours. As Ralph knows, I talk a lot, so I'll stop here. But do you have any questions for me?
I will say that when I walked in the door, it was, you can always, and you never judge a book by its cover, of course, of, first time or whatever, but when I walked in the door, I felt the care attitude from all the staff, not just her, but the care attitude. And yes, she does talk a lot, but no, she is very, I was very pleased, definitely.
It's because I have so much to share and so much to say about our wonderful, our patients, but also our team. Like I said, everybody who works at St. Vincent Clinic, I can say across the board, is there because they have a heart for the mission. So it's a great inspiration for me every day to be there. No questions? question? I can't talk anymore?
I do plan to use that one next time somebody tells me I've spoken too much. I just have a lot to share. No, I don't have any questions.
Okay.
I think it's fair to say that there's a handful of us in here that know that we just like walk all over the top of each other when we're all excited talking about something, and it's how we get going, so that's a fun, well, thank you.
Okay, well, thank you for giving me the opportunity to speak to you today.
Correct, thank you.
So the public service agencies are welcome to stay or leave, whatever you would like. This is an open public meeting. And thank you so much for being here, and I just want to
They're outta
say,
here.
from the absolute bottom of my heart, personally and
Absolutely.
professionally, every single one of these agencies are completely amazing. I am very, very glad all of these agencies have applied for funds. I'm glad to see Leavenworth Mission back here requesting funds. And when I have to write anything to HUD about our public service agencies, it is not difficult. I usually send something off to them and say, hey, can you confirm this verbiage or what has changed? And I'm always in awe of how they update me about how much more they're doing.
They have a lot to say.
Yeah. Amazing group of people that have cohesive working relationships for the greater good of our citizens.
Yes.
That's awesome.
Definitely.
We applaud you.
Thank you
We
all.
applaud you. We'll call it the Beth Watkins filter.
The Beth Watkins filter.
Thank you.
Thank you very much, bye-bye.
Easy people to brag on.
Yeah,
Heartwarming.
yes, they are.
Well, I
Inspired to be
would like to share with you, because it's a whole lot of information, if I could just quickly give you, do a quick rundown of that aggregate information that I have in front of you. And then you all, as a board, will be able to determine upon the voting of the funding. So, just in case some of it doesn't make sense, I'm just gonna zip through the columns. Of course, we have the agency name listed first. It is in that light blue. According to every board member's turned in score sheet, the aggregate count overall percentage, that's what that next is. So that first agency being 95%, and of course, so they ranked number one. Of course, that's in the scoring aspect of the applications, okay? Their primary thrust of work is listed. And then, of course, those three columns, just identifying how many of the persons they serve are of extremely low income, very low, and low, if not moderate income. And those are by HUD income limit guidelines, okay? Nothing that we've created or made up. Those by the HUD income limit guidelines. The next column, the 2023-24 funded amount, that is the amount that these agencies are currently getting this year. If you remember, last year, we did have a sixth agency who opted to bow out.
Yes.
Right, and so that's why we went from 6 agencies to 5 last year, and we were then able to spread out pro rata the rest of the funds. So this year, we were back to having 6 agencies again, wanting the funds. So that next column is how much they've requested. So for instance, that number one agency at the top, they are asking for 15,000. And then I listed what's the percentage of that of their annual expenses. So they're asking for 15,000, which equates to 4.08% of their annual expenses. I thought this would be helpful information for you to have in front of you just while you're making decisions, if any of those factors are things that are important to you about making those decisions. I do have 2 options. They're listed for discussion purposes only. This is not me advising you have to choose one or the other. This is me just putting some information out there so that you all have some talking points or a baseline to go from. So if the stuff listed in purple, option number 1, if you went with, and I'm sorry, we're going to use the projected figure of 51,000 like last year until we get the actual, okay? And so that's what the total amount can be. Option number 1 is listed if you basically awarded them funds according to who had the highest score. That's how that is flowing and looking, starting at deducting 28% of the ask with the first agency. You will see that there are 2 agencies there, agency number 3 and number 4. Their ask, one of them's 8,000, the other one is 7,800. Now, the reason there I have that listed as giving them their full ask in this column is because if you took the 51,000, divided it by 6, you got $8,502. We wouldn't ever want to award an agency more than what they've asked for. They have other programs that they have to run, procedures they have to abide by, and a budget to follow. And sometimes giving them more than what they were asking for is not always the best thing. And they are aware of this because we've had those conversations. So having said that, the one agency that's asked for 8,000 and the agency that's asked for 7,800, that's less than the amount than if you had decided to split it up 6 ways. So that's why I just had that listed as full ask. Again, these are talking points for all of you. Option number 2 has, just so you can see what those figures would look like, has those 2 agencies at their full ask, and then the last 4 agencies dividing up evenly by 4 with the remainder. So those are just ideas of what that looks like, and so if there's any questions I can answer, you can let me know. Otherwise, you can discuss amongst yourselves how you would like to fund these agencies with a expected budget of 51,000.
So I acknowledge that these scores are close enough for me that it's almost enough just to not use them as any kind of indication. I feel like they're, anything above 90 really speaks to the excellent preparation of and information provided based on the packets we reviewed. So in my mind, that's not something I'm really concerned with as far as that 5% between the number 1 and number 6. So I personally would take that out. I'm not saying that. So that's a little discussion that I would like to throw out there.
They're all asking for utilities and rental assistance too, so it's like, it's not like it's
That's evolved. I mean, I don't remember how long ago, but we limited it. This board one time decided that we would limit to
rental
utilities and rent with all the other expenses they have. That, I mean, since we're HUD, but that's up for discussion if we'd like to change it. It's just really difficult to decide who's more needy than anybody else.
Yeah.
I would like to say that if you would like to change how they're going to use their funds for this next grant year, we will have to start a whole new process and come to those conclusions for this year. Otherwise, if you all would like to change that, then we can certainly do that and be prepared for the next year. Just to know. The rent or utility reimbursement for the actual agencies then allows them to use those funds in the manners of which they service. And I went back over and I watched and listened to some of those meetings from a long time ago, and that was the determination then as board member Mike Super says. So if anybody is wanting the history of that.
I wasn't on the board when that was decided, right? Just making sure.
No, you weren't.
Oh, it was, I don't even know if Charles was
I'm
here.
pretty sure I was. I think I had
Okay.
just come on board.
It was a long time, I mean, it was a long time
As long as it's
ago.
something I didn't remember, okay.
That galaxy far away. But as a board, we do evolve.
Yeah. Well, Ralph's hair was not gray then, so.
The honorable vice chair.
I'm, so, in the interest of kind of sparking some conversation, I'm big on option 2.
Yeah.
And the reason I'm big on option 2 is because it's
even.
fair. It's fair and it's even. It literally provides, you know, a certain amount for all of those. Yes, it kind of, and it's not a gut punch to any of those, you know, it's not a gut punch to any of those agencies. They understand what we're working with, and you know, and I think they understand that there's a point where we may or may not receive some more money to redistribute, so I mean.
Correct, and that is also something, once you all decide how you want the funds distributed, I am asking for you to also put in that we will fund pro rata. Remember, we were talking about that last year.
I still use that every
That
day.
you will fund pro rata. That way, it would save any idea of me having to ask to call for another meeting to bring you back here. Because the likelihood that HUD's going to award the absolute exact same amount to the dollar is unlikely. So if there are more funds to distribute, if when you vote, you could add in the fact that it would go pro rata, that way we can even distribute, not bring you back.
Okay.
I think option 2 looks good too. I mean, nobody's gonna second
So
guess
you
that.
don't know how much money you would be getting that would be redistributed? You don't?
Sometimes we don't even find out till
No.
July.
Oh, okay.
Yeah,
May is nice.
it varies. Last year, I believe it was the last week of February of 23, had let us know what the award was going to be. So we knew what we were going to get, or we had an idea pretty good of what we were going to get, right? But this year, it has not been announced yet, and there are many years that the funds are actually, the last several years, the funds have not been actually available until September, and I think a couple of years ago, October. So the grant agreements for these CDBG funds to go to these agencies, I do not even compose and distribute those agreements for the city manager to even sign until after I know what the amount is gonna be. Otherwise, you're creating amendments and whatnot. And I know I'm going a little bit further than what you asked, but I could just imagine some of those things kind of being the next questions. So what I do is, after this meeting, after you guys have voted, then I make sure that I send out information to the agencies, letting them know, here's how you all determined how to vote, and here's what it's gonna be. It's gonna be based at the 51,000, and then explain from them where to go from there. That way they at least have an idea of knowing of what is coming.
Yeah,
Some transparency.
Yeah, absolutely, 100%.
yeah, that makes
Yeah.
sense.
So, I want to make sure I capture the vote or the question of the vote correctly. So we need to, number one, figure out which option, and then once option is selected, the additional language needs to speak to the pro rata.
Yes. And that would be so that I can evenly distribute percentage-wise. In this case, if you went with option 2, that's pretty simple. It would just mean that it could be evenly distributed, so I didn't have to call you back here again for another meeting.
Well, I'd like to make a motion that we select option 2.
Okay.
With the contingency that if there's more or less money distributed, it will go into each group evenly up to their ask.
You're not gonna make me repeat that, are you?
Perfectly worded.
I hope not.
Second.
Hope I hit all the checkpoint checks.
So I have a motion and I have a second. All All in favor for the option with those caveats that were outlined ever so eloquently by Mike. I used caveats, so I get a credit there. All in favor, say aye by your name and your vote.
Mike Sufert, aye.
Mary Mack, aye.
Charles Davis, aye.
Ralph Taylor, aye.
Brian Keely, aye.
Motion carries. Option 2 is selected with said caveat. Why is it so warm in here?
I think it's cold over here, by the way.
It is.
Is it?
No, it is cold. I was just messing around. Option 2 it is.
I thank you very much. And also, Board Member Mary Mack, if you ever are curious and haven't seen it listed or posted anywhere and you're just curious, please just give me a call or shoot me an email and say, hey, did we ever know what the amount was? I'll be more than happy to give you any of that information. I'm hoping that we do hear some more information or hear some information soon because the 2024 annual action plan is in draft form at the public library. It's in our department. It's online. So our next meeting is to approve or disapprove of that plan, and fingers crossed. It always works out so much nicer when we have the exact amount. Otherwise, I'm doing pro rata math. Going back over the others because I also have that listed in that plan, so.
Thank you.
Item number 6.
Other matters, correspondence.
I have nothing.
Ooh.
Item number 7.
Sounds like a good time to meet.
Sounds like a
Yep, so that's our last public hearing for this next grant year is on April 8th. So we will, like I said, I've let you know where the annual action plan is in draft form has been available. It has also been made clear anybody who wants to speak for or against it, they don't just have to come to the public hearing, they could also email or call. So far to date right now, I have not heard from anybody, but it also hasn't been up since March 7th is the day it went up. And so when we meet on April the 8th, you will have been given that in draft form and told if those are our final numbers or not. And after your approval, hopefully, then I'll be taking it to City Commission the 3rd week of April for submission to HUD, and then we wait.
Okay.
I move to adjourn.
Do I have a second?
I'll second that.
I have a motion to adjourn. I have a second. All in favor to adjourn, say aye with your name.
Mike Sufert, aye.
Mary Mack, aye.
Charles Davis, aye.
Ralph Taylor, aye.
Brian Keely, aye.
Vote carries. We are adjourned.
All right.
Oh, you're on May 3rd. That's good.
What's easier said than done?
Yeah, you can.
Sure. Thank you so much for giving me a long.